Hello friends, welcome to my channel called Med Recall by Dr. Sonali. So let's start our today's topic, which is respiratory system with positive vibes only. Okay. If we want to divide respiratory system structurally, it can be into upper part and lower part. So upper respiratory tract will include nose, nasal cavity and paranasal sinuses, whereas lower respiratory tract will contain larynx, trachea, bronchi and lungs. In this diagram, you can appreciate upper respiratory tract, which is nose from here. There is nasopharynx also. Then there is larynx, trachea and bronchi will be further below. Let's see further structures. The first will be palate, which forms boundary between respiratory tube and gut tube. It has two surfaces. So palate has two surfaces. Upper surface is lined by respiratory epithelium, whereas lower surface is lined by parakeratinized stratified squamous epithelium on oral surface. Okay. Then comes epiglottis. Epiglottis again has two surfaces, oral surface and then laryngeal surface. Oral surface is lined by stratified squamous epithelium, whereas laryngeal surface is lined by respiratory epithelium, which will be ciliated columnar epithelium. Epiglottis is cartilage, so elastic cartilage is present. Then there are nasal vestibule and vocal cords. They are lined by stratified squamous epithelium. Whereas adenoids and tonsils, which are lined by respiratory epithelium, which is also called as pseudostratified ciliated columnar epithelium with goblet cells. And roof of nasal cavity is lined by olfactory epithelium, which is also called as neuroepithelium. And larynx and trachea are again lined by respiratory epithelium, which is nothing but pseudostratified ciliated columnar epithelium. In this diagram, you can appreciate this is hard palate and then this is soft palate. Then this one is epiglottis and then there is vocal folds, these slit-like structure which is shown in this cross section, cricoid cartilage and this thyroid cartilage. These all things which are cartilaginous, it forms larynx and trachea, which comes under lower respiratory tract. Let's see, this is histology slide of epiglottis. This is lingual surface of epiglottis. Then elastic cartilage is present. This one is elastic cartilage, this blue thing. Then lymph node and pharyngeal surface of epiglottis, this one. And epiglottic glands are present here. This is pinkish bunch of cells like showing epiglottic glands. Sir, we have seen this division on the basis of structural classification. Now, if we are going to classify, now let's classify the respiratory system on the basis of its functions. Main function will be respiratory pathway and then conducting pathway. So respiratory pathway will include alveolar duct, alveolar sac and alveoli, whereas conducting pathway will include trachea, bronchus, bronchioles, terminal and respiratory bronchioles. See this image. This is trachea. Then it will divide into right and left bronchus. Okay. Then these bronchi again further divides into bronchioles. Then terminal bronchioles and then respiratory bronchiole further. Then alveolar ducts and the alveolar sacs are the end point. Okay. So conducting pathway will terminate up to terminal bronchioles. Okay, conducting pathway includes trachea, bronchi, bronchioles and terminal bronchioles. Whereas respiratory pathway includes respiratory bronchioles, alveolar ducts and alveolar sacs. Alveolar sacs are lined by simple squamous epithelium for gaseous exchange. And gaseous exchanges happen with the help of type 1 pneumatocytes. Okay. And another thing, the trachea is cartilaginous. Okay, so cartilage, which cartilage is present in trachea? So it is hyaline cartilage and goblet cells are also present, but they extend up to bronchus only. Okay, जहाँ तक bronchus है वहाँ तक ही सिर्फ हाइलाइन कार्टिलेज एंड गॉबलेट सेल्स प्रेजेंट होंगे. उसके आगे जो भी डिविजन्स है ब्रोंकियोल्स, टर्मिनल ब्रोंकियोल्स एंड रेस्पिरेटरी ब्रोंकियोल्स, डक्ट्स एंड सैक, देन there you will not get any kind of cartilage and goblet cells. Okay, let's see some special features regarding bronchus. It contains smooth muscles, hyaline cartilage and goblet cells, respiratory epithelium, and mucosa associated lymphoid tissue. And then in bronchioles, which is further division of bronchus, there is no goblet cell. There are no goblet cells, no hyaline cartilage, but smooth muscles will increase in number. Okay. In terminal bronchioles, there will be clara cells, ciliated cells, club cells, and squamous cells. Then come to what is Kulchinsky cell. These are clinical points regarding MCQs. Kulchinsky cells are nothing but they are neuroendocrine cells of respiratory epithelium and they secrete serotonin. And the source of small cell lung cancer. So in small cell lung cancer, you can get serotonin levels are high because of these Kulchinsky cells which secrete them. Now in this slide, you can see the different kinds of cells we discussed. So this is ciliated cells which are helpful for sweeping away the mucus and trapped particles upwards, keeping respiratory tract clean and free from intestine, from infection. Okay, so main function of ciliated cell is sweeping and cleaning the tract. Okay, then comes basal cell. Basal cell acts as stem cells. They help in repair, regeneration and maintenance of airway. Then comes intermediate cells, and then clara cells. So the main function of clara cells is they secrete surfactant, okay, detoxify air, acts as stem cell also. And then goblet cell, they mucin secretion, they secrete mucin, particles trapping and humidification. And then comes alveolar macrophage which engulf dust particles. And type 1 alveolar cells and type 2 alveolar cells. Type 1 alveolar cells helpful in gaseous exchange, whereas type 2 alveolar cells are helpful for secretion of surfactants. Okay. So these cells are very important. So remember them for MCQ purpose. And this is histology slide showing some tissue of respiratory tract. Here you can see this is cavity or lumen of respiratory tract. This is bronchus because its size, देखो size देखना है, इसका size बड़ा है. Okay, that's and there is a bronchiole. Okay, this lumen is clear, so यहाँ पे air होगा. And then the size, according to this size as compared to other tissue, this is bigger, so it is bronchus. Okay, and then you can see cartilage also. This is cartilage plate, and this is bronchiole. It is smaller than this bronchus. Then there are pulmonary vessels. This pinkish material is showing blood, red blood cells. These are pulmonary vessels. Okay. All this tissue is nothing but alveolus. So in this topic, we saw some concepts regarding functional and structural division of respiratory system and saw some cells of the respiratory tract. Along with it, we also saw histology slide showing respiratory tissue. So I hope you will like it. Thank you for watching. Bye.